next few patients. Here we go. It's Wednesday, September 15th. We've had a little bit of a internet glitch or whatever. It's delayed us a little bit here, but as I told you on Monday, you know, a lot more people are going to die. I've told you over and over and over that there's no need, in my opinion, to even think about, you know, from the standpoint of the mask, you know, if you mandate mask, really and truly what you're doing is you're basically penalizing some. The mask, in my opinion, I'm still not convinced are going to really help us in a really significant way. I applaud, you know, our school systems that have decided to go that way, and we surely want to protect our kids first and foremost. But I also would just tell you just this, that you know, Dr. Tom Takubo was with us, and he passed on a statement to me that I related on to everyone, and because I thought it was really profound. He said we have reached a point to where now we're in a situation to where, for the most part, people that have been vaccinated are going to be protected. So we've reached a point in time, and his words, that really this disease has become a disease of the unvaccinated. Now, a lot of people don't like me saying that, but really, when it really boils down to it, it is a profound point that a doctor has made to me, and I think that it is extremely profound if you think about it. The chances, if you're not vaccinated, of you getting this are moving up each and every day. Now, we're very hopeful that what's going to happen is we're going to reach a peak and then we're going to turn the other way. But we're not there yet, are we? And in the meantime, if you're not vaccinated and you have not had COVID, you're running a big risk. And that's what, you know, our good Senator Takubo, I always struggle with that, but passed on, which I think is real knowledge. And that knowledge, again, centers around just this. If you're not vaccinated today, there's a really good chance, you know, that you're going to have at least a legitimate chance of ending up with this. If you survive it, after you survive it, your antibodies will truly help you. There's no question, you know, it's very argumentative that it could be that they will be as good as the vaccinations are. The medical community still doesn't really believe that, but I'm going to always tell you the truth, and I'm going to tell you what's reported out there. There's many places that report out there that if you get this, your antibodies are even better than the vaccines. But one thing for certain that we know for certain, a good doctor, our senator that was with us, said just this. Now, he's a pulmonary doc. He's a doc right in the middle of the fire at a big hospital right here in this beautiful city of Charleston. Now, with that being said, just think about it. He said, I have not treated one person yet that had a significant adverse effect of being vaccinated. Not one. So what does it tell us? It tells us that the vaccines are really safe. It tells us that if you're not vaccinated, there's a real chance you're going to get this. And then there's one of two things that are going to be the outcome. Either you're going to make it through it, maybe one of three things. You're going to make it through it, which would be wonderful. You may very well end up with antibodies after you make it through it. And you may very well end up with side effects for a long time to come. So, he's right. He's right. For the most part, where we are today, is those that are being hospitalized, especially those in the ICU unit, are overwhelmingly the unvaccinated. So for the most part, we are dealing with a disease that is attacking the unvaccinated. It is a disease of the unvaccinated today. Now, you can still get it if you've been vaccinated, but just look at these charts just real quick, and then I'll go further here. From the standpoint, all this in yellow and blue, these are the people that are hospitalized in West Virginia. The yellow are unvaccinated. The blue are the folks that are vaccinated. 84.8% of the people that are hospitalized in West Virginia are unvaccinated. Now get this, it only gets worse. From the ICU units, 90.6% are unvaccinated. 9.4% of the folks that are in the ICU units are vaccinated. Now, the net of the whole thing is just one thing and one thing alone. If you have chosen to be unvaccinated, in my opinion, it was a bad choice. It was your choice. There is no question, and I want to underline, triple underline, quadruple underline, Jim Justice thinks it is wrong for President Biden to mandate. Jim Justice thinks it's wrong, and he will not stand for it in any way, for him to mandate that our businesses have to mandate for them to make sure that their employees are vaccinated. Now, I think it's wrong. We don't need mandates, but you need to make a great decision right now. Absolutely every single thing is in front of you. The good senator that was with us yesterday, day before yesterday, all the knowledge that we have out there, everything is telling us one thing, and that is just this. More and more and more people are dying. More and more is there a need for you to get vaccinated. For you to get vaccinated to save your life, to save the life of loved ones around you, to contribute from the standpoint of being absolutely one that's stepping up and trying to move us forward. Since I was with you on Monday, 58 more people have died. It's unbelievable. It's totally unbelievable. 58 more people have died. I'm sure overwhelmingly, these are unvaccinated people. Please join me in your prayers for all these people and all their loved ones. The 3,239th death in West Virginia is an 87-year-old male from Summers County. The 3,240th death is an 80-year-old female from Summers County. The 3,241st death, a 52-year-old male from Fayette County. The 3,242nd death, a 55-year-old female from Mercer County. The 3,243rd death, a 49-year-old male from Lincoln County. The 3,244th death, a 65-year-old female from Berkeley County. The 3,245th death, a 77-year-old female from Wayne County. The 3,246th death is a 48-year-old female from Greenbrier County. The 3,247th death is a 64-year-old female from Lewis County. The 3,248th death is a 90-year-old male from Preston County. The 3,249th death is a 90-year-old male from Lincoln County. The 3,250th death is a 71-year-old male from Mercer County. The 3,251st death is a 71-year-old female from Tucker County. The 3,252nd death is an 80-year-old male from Monongahelia County. The 3,253rd death is a 79-year-old male from Putnam County. The 3,254th death is an 85-year-old female from Cabell County. The 3,255th death is a 45-year-old male from Upshur County. The 3,256th death is a 79-year-old female from Hancock County. The 3,257th death is an 89-year-old male from Wood County. The 3,258th death is an 80-year-old male from Mason County. The 3,259th death is an 87-year-old female from Jefferson County. The 3,260th death is an 80-year-old male from Tucker County. The 3,261st death is a 66-year-old male from Mercer County. 14 of these deaths are reconciliation deaths. Of the 58 deaths, we've really lost 44 people since I was here with you on Monday. I was wrong in that. Nevertheless, it's just terrible. Today, September the 15th, 35 more deaths. The 3,262nd death is a 62-year-old male from Harrison County. The 3,263rd death is a 74-year-old male from Preston County. The 3,264th death, another in the 40s, a 46-year-old male from Upshur County. The 3,265th death is an 87-year-old male from Mineral County. The 3,266th death, a 47-year-old female from Cabell County. The 3,267th death, a 61-year-old male from Berkeley County. The 3,268th death, a 71-year-old female from Pleasance County. The 3,269th death, a 79-year-old male from Harrison County. The 3,270th death, an 88-year-old male from Mingo County. The 3,271st death, a 79-year-old male from Randolph County. The 3,272nd death, an 80-year-old male from Tyler County. The 3,273rd death, an 81-year-old male from Mineral County. The 3,274th death, a 72-year-old male from Harrison County. The 3,275th death, a 75-year-old female from Kanawha County. The 3,276th death, a 50-year-old female from Kanawha County. The 3,276th death is the 3,277th death is a 69-year-old male from Hancock County. The 3,278th death, another 40-year-old, 47-year-old male from Cabell County. The 3,279th death, a 73-year-old female from Calhoun County. The 3,280th death, another 40-year-old, 46-year-old female from Harrison County. The 3,281st death, a 69-year-old female from Mineral County. The 3,282nd death, a 73-year-old male from Jefferson County. The 3,283rd death, a 29-year-old male from Berkeley County. The 3,284th death, a 54-year-old male from Kanawha County. The 3,285th death, a 58-year-old female from Work County. The 3,286th death, a 58-year-old female from Monroe County. Another 40-year-old. The 3,287th death, a 44-year-old male from Raleigh County. The 3,288th death, a 71-year-old female from Monongahela County. The 3,289th death, a 58-year-old male from Mingo County. The 3,290th death, a 55-year-old male from Monongahela County. The 3,291st death, an 80-year-old male from Kanawha County. The 3,292nd death, a 58-year-old male from Lewis County. The 3,293rd death is a 67-year-old female from Raleigh County. The 3,294th death is an 82-year-old male from Kanawha County. The 3,295th death is a 77-year-old male from Logan County. And the 3,296th death in West Virginia is an 87-year-old female from Logan County. 1,805 new positive cases since the last time we were here. A daily positivity rate of 10.85, cumulative rate at 5.57, active cases in the state of West Virginia, 27,674. 879 people hospitalized, all-time record. 267 patients in the ICU unit, all-time record. 158 patients on a ventilator. I'm sure that's a record as well. You know, we have one green county in the state of West Virginia. We have 43 red counties in the state of West Virginia. School numbers are 87 outbreaks in 33 counties, 677 confirmed cases. 7 schools are closed. 1 county completely closed, that's Preston County. There are 53 counties now that have mask mandates. The only 2 that don't are Putnam and Pocahontas County. Like I've said, overwhelmingly the people that are in the hospital are unvaccinated. A reminder of the 65 and older, if you have any symptoms at all, you better get a test really quickly. You know, if we catch it early enough, we can give you the antibodies, and if we don't, you're in for a tough, tough, tough go. I encourage everybody in large settings, especially indoors and everything, to really consider really seriously, especially if you're over the age of 60 or whatever, or have any complications whatsoever, really consider wearing a mask. You know, Pfizer's FDA totally approved. We're ready to go on the booster stuff as soon as we get the go-ahead to go. The FDA Advisory Committee is scheduled to meet Friday to discuss the booster shot, and I strongly, strongly encourage them to approve us and approve people to go that are 6 months out. We have many, many great West Virginians that are way beyond the 6 months out and everything, because we led the nation in getting the shots in arms and everything, and now we've got people that desperately, desperately need that booster shot. We had 4,200 people that have been vaccinated since the last briefing. That's 4,200, and that's 4,200 that was no question whatsoever we will have saved some people's lives there. But it's not enough. It's just not enough. We have 1,153,368 West Virginians with at least 1 shot. Thank goodness we've got our elderly over 65 with 92.6% have had 1 shot. Thank goodness that the people that are over 50 are at 86.5% have gotten 1 shot. We're at 74% of the 12 and older now that have received 1 dose. And all those numbers look halfway decent, but truly we just need to do better. We'll be out on the road again tomorrow giving things away from the standpoint of Do It for Baby Dog 2, round 2. You know, it will make some people really happy, but more than anything, we'll continue to encourage and continue to try to get especially our young people across the finish line. You know, eligibility against 12 and older young people, we need the help of the parents, and we need the help of all those grandparents and everything to get the young people across the finish line. We need them vaccinated. You know, all the info on the vaccine on COVID is up on our website right there. Let me see everything. You know, all the free testing information's up there. I always want to thank Fruth and Walgreens for what they did stepping up early on. We really, really appreciate them for long ways back and everything, how they stepped up. We have 76 outbreaks in our long-term care facilities. We have 3 in our church community. That's Monroe, Raleigh, and Wayne. Our church community is stepping up and doing good work there. Corrections, we're at 210 cases in 11 facilities and 49 staff cases in 21 facilities. You can see there's no getting away from it. It's all around everywhere. And the only way you're really probably going to stand a great chance of getting away from it is to be vaccinated. I encourage you about giving blood. And let me see if there's anything else here that I've got to report to you. Our grand families announcement is that registration is now, it's been open and everything. We need our grand families so badly to get the kids in those households and everything's vaccinated. There's 19,000. Of course, we want our grandparents vaccinated as well too, you know, but, and we want you registered and everything to where we can send this $150 school voucher to you for the great work you've done. And I love this saying here. It says, we are saving our wisdom who are saving our future. And so I don't know how it gets any better than that. The unemployment rate in the state of West Virginia is unbelievable. Right now we're at 4.8%, you know, and we continue. This is the 16th straight month that the unemployment rate has gone down. You know, no one is more proud of that than myself. You know, it takes a lot of work from a lot of people, but really and truly, we've got to be really proud right here and all throughout our state that we've pushed the right buttons. We've got an additional 1,500 people that are back into the workforce, and unemployment as it continues to drop. You know, the national level is at 5.2. We're under the national level, and we've been there for a long time. We've been there since June of 2019, and so we want to just keep at it and keep pouring it on. West Virginia, you're doing great work. The economies of this state are in good hands and good shape, and we want to keep it moving that way. And I've got one announcement here. Had a conversation with our Secretary of Tourism and everything, Chelsea Ruby, the other day. You know, it was really last Friday on you know, on how our state agencies should handle Bridge Day this year. You know, there was even a possibility, you know, I guess, and really, I guess this decision is made through a committee, you know, a Bridge Day committee and everything, but there was even a possibility of not having Bridge Day. I said, no way, if, you know, all we can do is encourage. I mean, it's their event, and it's, but from a standpoint of the government, I think wholeheartedly we should go forward with Bridge Day. You know, we're having football games and everything, you know, where we had the big gatherings and everything. So why in the world should we not have Bridge Day? And it's a celebration that a lot of people have come to and enjoyed, and it puts a spotlight on our state again. It makes a lot of good things happen in an area of our state that desperately needs help, and it's an event that just, again, showcases West Virginia. So our DOT and our state police and tourism department are ready to handle this event, and they'll do what they need to do to support the event if the board chooses to move ahead with it and have it. And you know, I have not shut down the large events, nor am I going to, and at least, I guess you never say never on anything, and we want to be nimble enough to move and adjust and everything. We've said it over and over. There is no playbook here. There's no playbook at all. But right now, from my standpoint, I have no intentions whatsoever of shutting down these large events. So I hope they choose to have Bridge Day. But that's all I got right now.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. As the governor said, we are still experiencing a substantial set of challenges with the Delta variant in West Virginia and in the United States. You know, we just celebrated the memorial of 9/11, and yesterday in the US, we had about as many people die yesterday from COVID-19 as died in the 9/11 event. And that should be sobering to all of us as we look forward and see that, you know, the cases are continuing, new cases continuing to rise. And looking at our hospital systems, I know General Hoyer will touch on this as well, but we have seen more people in West Virginia hospitals and ICUs and using mechanical ventilators than we've ever seen before. and the governor keeps reading more names every press brief of good West Virginians that have succumbed to COVID-19. And I think it's really important to recognize, what the governor said, which is, our two goals in this pandemic at the very start and in the continuation and today is to try to save the lives of our citizens and try to make sure that we maintain the capacity in our healthcare systems, our hospitals and others, so that West Virginians can be taken good care of. And as we look at the best way to do that and start to reflect on how we can protect people in the best possible way, we recognize, just like data from the CDC and many other places, that full vaccination is really still the key. And on the DHHR website, we see that of our 3,294 deaths, I believe, we know that 104 of those deaths were in fully vaccinated people, which gives you a rate of 0.011% of people fully vaccinated who have died from COVID-19, which is an extraordinary level of protection. As we look at other countries and other states that have dealt with this level surge, again, we know that this is a very rapid upswing, and we will eventually get to the top of that and start to come down. But as we see in other countries, the hospital numbers and the hospital stresses will likely continue after the new cases start to reduce in the speed of infectiousness. And so we're very concerned about that. And deaths of West Virginians is even a longer indicator that we anticipate will follow. So it's really important for us all to be very cognizant about protecting ourselves right now. Certainly getting fully vaccinated is an important solution. The governor did communicate, which is absolutely true, that there is a study from Israel that suggested that native immunity was very important as well, and we know that. But we also know that for people that get COVID infections, about 10 to 11% of those people are still impacted negatively in their health and disabled from their normal activities at 7 to 8 months afterwards. And again, we have lost more than 660,000 Americans and more than 4.5 million world citizens to this pandemic, and we're not done with it yet. So West Virginia, it's really important for us to continue to work together, to pull the rope together, as the governor has said. And right now, even more important because of the stress on our healthcare capacity, that by protecting ourselves and being fully vaccinated, we protect each other and we protect our healthcare assets. So not only do we do a great job taking care of the people that might get sick from COVID-19, but also for people that need our hospital capacity for other things. And as we look at our hospital numbers and look at our ICU numbers and look at the people on ventilators, there's an overwhelming majority of those people that are not vaccinated at this point. So be careful and stay together, and we will certainly make it through this, but we do have some turbulence ahead. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, Director of our Joint Interagency Task Force.
Good morning. As the governor pointed out, we have made slow but steady progress on vaccinations, with 74% of the eligible population eligible to receive the vaccine having at least a first dose, and 60% of those eligible to receive the vaccine fully vaccinated. But as the governor pointed out, it's just not fast enough. And the best way to highlight that for West Virginia is while we were in the middle of this press conference, you saw some earlier numbers, but the new updated numbers for hospitalizations are 893, with 33 additional suspected cases, 275 in the ICU, and 160 on ventilators, with the significant majority of those, as you saw from those numbers in the graphs that the governor showed, are unvaccinated West Virginians. And we have had a couple of cases in the last couple of days where hospitals have received phone calls from as far away as North Carolina about the possibility of transporting critically ill patients from that state to West Virginia because of lack of resources in that state. But our hospitals don't have the capacity to take on those additional ill people from other places. But that also points out, should we get to a capacity point, which we are close to, we will probably not have the ability to transfer patients to other states, or we'll have challenges transferring patients to other states. Currently, our hospitals across the state are working on what they call modulating procedures, meaning that non-essential procedures and elective surgeries are being managed at the hospital level to maintain the integrity of their systems. Many of, if not all of our hospitals have closed beds because of staffing issues. And going back to, again, just to reinforce the governor's point, all this can be avoided if we continue to press hard and we get West Virginians vaccinated. We can get through this appropriately. Thank you.
Thank you, sir. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good morning. I just wanted to give out some information. We did issue a health alert yesterday to our health departments and physicians across the state. Flu season is coming up, and we do want to remind everyone that you can take the flu vaccine as well as the COVID vaccine at the same time, preferably in separate arms if you can, because before, we were advising 2 weeks apart between the two vaccines, but we do not want to have a twin pandemic on our hands in the upcoming season. So we just want to remind everyone that you can get both vaccines at the same time. Thank you.
Thank you, Dr. Amjad. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good morning, everyone. I just want to thank everyone for their patience with regard to the delays on the dashboard yesterday and Monday. We are still having some technical difficulties. We had a team working all day yesterday into the night. Our folks are trying to track down the problem. As with any technology, there are sometimes glitches, so I apologize for that. We have folks working on that and very dedicated to fixing that. So I want to thank the team at DHHR and our external vendors and others who are involved in this right now. So thank you for your patience on that.
Thank you, Secretary. We'll now go to questions from members of the media. Our first question today is from Kenny Bass with WCHS and Fox 11. Kenny, are you there? Your mic is muted.
Hello.
Go ahead, Kenny.
Sorry about that, guys. I was having a phone difficulty. I've been asked by several people, and I don't know the answer to this. So I'm hopeful that maybe Dr. Marsh or Dr. Amjad or General Hoyer can straighten this out. But in the approval of Pfizer by the CDC and the FDA as now an approved drug, people keep sending me stories that say, well, that drug now has a name and it's now legal. But that the serum that's already in vials that has already been produced and was manufactured under the emergency order, that serum isn't covered by the umbrella announcement by the FDA, and possibly because it was an emergency order that made it possible to use, that some insurance things come in and some liability concerns come into the picture. I honestly don't know, and my research hasn't been able to find it. So if Dr. Marsh or Dr. Amjad or General Hoyer, once the stuff was approved by the FDA, did that mean all of it, even the emergency supplies, fall under that umbrella? Are we looking at two different categories here? Thank you very much. And again, I apologize for the technical problem.
Dr. Marsh, this is you, sir.
And it's the same drug and it's the same vaccine. The brand name has been added, but this is exactly the same vaccine, the same dose, and even some of the same vials that were produced earlier. The FDA just has a process. They had a rigorous process to get to the emergency use authorization. They fully approved the vaccine after being presented with data that Pfizer has gathered with the hundreds of millions of doses of vaccines that have been delivered now. People should feel assured that the vaccines they got under the emergency use authorization and the vaccines they will get under the full authorization are exactly the same and should have the same potency and the same benefit.
Thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. In the midst of the press conference, I had a visitor. Terry McCaw is the widow of Dr. Sean McCaw, who died from COVID-19 complications in the spring. She was here to encourage everyone to get the shot. She described what had happened with his case. He was scheduled to be vaccinated on January 6th, but he came down with COVID-19 on January 1st, and from that point, spent several weeks in the hospital and then passed away. So to pass that along as a cautionary tale, I want to add to your voice, Governor, and everyone else on the panel. General Hoyer, we're supposed to, at least the target date for the Biden administration approval of booster shots is supposed to come Monday, and I know you said you're ready to go whenever you get the word. Have you gotten any indication of when you will get the official okay to go on September 20th? And if you are, how are you going to be able to notify the people that need boosters quickly enough to get people there at the clinics? Thank you.
Paul, before I go to the general, and I'll go to him just a second here, please pass on our regrets, our prayers, our thanks, in losing a doctor. You've been a really good man, Paul, and I know in your voice you're really sincere, and I'm really just proud to have gotten to know you, and so I thank you a bunch, and please pass on, all my love and prayers, for the kind lady that lost her husband, a doctor. But anyway, General Hoyer, if you could go now, please.
Yes, sir, Governor. So, Paul, it's all about contingency planning because we don't know when they will give us the official go-ahead. As the governor's pointed out, being the first in the nation to vaccinate nursing home and assisted living facilities, that will be our first line of effort to get to, and then working at each county. We have county partnership teams at each county level that will work across a spectrum from hospitals to FQHCs to other places. So we'll, again, contingency, be prepared, ready to go, and hope that they make this decision is the right decision quickly.
Second, Nathan. Paul, this is just my gut, but, I read a lot. I talk to a lot of medical experts, not only ours, but medical experts all across the country. I talk to them all the time, and if you want just a distant shot across the bow and everything, I'm concerned that September 20th, it doesn't feel like to me that the federal government is moving. There's so many situations to where the Biden administration, we just can't get movement. And it wouldn't surprise me, I hope and pray, that on the 20th we're in full motion. We're going to be ready. We're ready right now, but surely to goodness we'll be in full motion on the 20th, but it really concerns me. It worries me, just gut feeling wise, it wouldn't surprise me at all that they move the date back. But I hope and pray they don't.
All right, thank you, Paul. Next, we'll go to Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members and fellow reporters. Governor, yesterday, 12 Republican state senators held a news conference. They want to be called into special session. Apparently, they don't have enough votes in their own body in the House and the Senate to call them the legislature, and they'll need you to do it. But they want to pass some legislation that'll speed up the process of getting these infusion therapies into West Virginia in large quantities that can be administered to patients outside the hospital setting and maybe help reduce some of the overcrowding because of the people actually hospitalized. What is the status of, and could you call them or add it to the call when they're in October for the redistricting session? What are the possibilities of this happening? And I'd like one of the doctors to comment on the efficacy of these infusion therapies and if they really work and if we need to get them here in bulk fast.
Well, Mark, everybody knows where I stand, and I'm rock solid. I haven't changed in any way from a standpoint of mandates. You don't see mandates coming out of me. The Biden administration is, I think they're way out on a limb in regard to these mandates. From the standpoint of calling themselves back into session or whatever like that, I don't have an outcry, that's coming through our people and everything that is saying that that's what they want to do. I'll be very respectful to whatever they do. I think we've got a great working relationship going on right now. I hope and pray it stays that way. And from the standpoint of where I am, I'm probably right in the same boat as where they are. But I need one of the docs that's going to talk to you more about the therapy that you talked about.
Ian, you want to start? You want me to?
You can go ahead, Clay. Thanks.
So thank you for the question. We know that these antibodies are remarkably effective at reducing the risk of hospitalization among very, very fragile at-risk populations up to 10 to 11 times, but really only effective if used before people have their oxygen levels go down substantially enough to be able to need supplemental oxygen therapy or to go into the hospital. Once people pass that level of the virus, blocking the virus from entering the body, because the monoclonal antibodies really bind to the virus, and they bind to the virus in the areas, the spike proteins, where the virus binds to the body and gains entry to the body. And so that's the reason why these therapies, these monoclonal antibody therapies, really optimally need to be used early in the illness, either right after people test positive or even used prophylactically, preventatively in people at really high risk. Once people get sick and the virus gains entry into the body, these antibodies don't work nearly as well. And the Delta variant is really different because it replicates, it multiplies very, very quickly, much faster than any form of COVID-19 we've seen today. So it's really important, as the general has said, the governor said, all of us have said, that we want to make these antibodies both available, but make them available to people as quick as we can get to them, after they may test positive or, be exposed to somebody who's positive for that high-risk population.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Marsh. So I read an article that was recently published in the Lancet Medical Journal, which said that the current evidence does not support the need for giving the general public this booster shot. Could you weigh in on that? Does the general public, if you're young and healthy, if you're under 65, you're not immunocompromised, do you actually need this third shot? Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Charles. So that article was written by two people from the Food and Drug Administration that are going to step off of that, step away from that organization. I think that they were upset about the commentary from the White House about dictating or projecting September 20th as the date of the boosters. They quoted three articles in the article from Lancet that were all published by the CDC and the MMWR, the CDC's own report scientific journal. And what they did demonstrate, Charles, as you correctly point out, and this is also what we have seen from the country of Israel, that in general, the people that might benefit the most from the booster shot are people who are older. You know, Israel did 60. The data that they quoted was 65. And this was not the Israeli data, which will also be presented. The published and unpublished Israeli data will also be presented Friday at the FDA meeting. But they really made the case that perhaps a more targeted group of people older who may be more vulnerable, who've been immunized 6 months or greater ago, may be the group to benefit the most from the booster vaccines. We know here in West Virginia that people over 50 years old accounted for 97% of our deaths. Certainly we're seeing younger people now because the group that's not fully vaccinated tends to be younger. Our older West Virginians have been fully vaccinated. But we know, particularly with Pfizer, the potency of that immunization does wane over time. So these two authors of that Lancet article, along with people from the World Health Organization, made the case that we should be immunizing people with first and second vaccines before we immunize with third vaccines. If we were limited by vaccines, maybe that's a reasonable approach. But from my perspective, we have plenty of vaccines, so we should do both. Of course, we want to immunize all that we can with first and second vaccines, but we also want to start to address our most vulnerable, our nursing home population, our elder population, particularly people with other illnesses who got their vaccines really early in the pandemic. We were first in the country to administer many of these. We really, I believe, will benefit that population dramatically in giving them a booster vaccine. So I'm very much of a proponent for boosters for the appropriate groups of people. And we are waiting now to see what happens from that FDA meeting and their biologic subcommittee, and then the CDC's, the Advisory Committee on Immunization Practices. Both of those groups need to approve the indication, and we anticipate that will happen probably for Pfizer before Moderna.
To me, just a second. Charles, if I could just add just this, and it's just an echo of Dr. Marsh, but the reality is just real simple. You know, the general public in West Virginia is older, and the general public in West Virginia is probably carrying with them more chronic illnesses, you know, whether it be diabetes or heart conditions or whatever it may be. You know, our general public, we have been the target of this disease from the get-go. And to protect us in every way that we can possibly protect us, I think absolutely if there's any state out there that needs the booster for the general public, I mean, it's probably us. And so remember, you know, considered to be the most vulnerable of all states, you know, and if that be the case, you know, we need the federal government to act, and we need them to act now. You know, but from my standpoint, an echo of Dr. Marsh, you know, and I'm not a doctor, and I listen very, very closely to the great expertise of, you know, of all of our experts, and Dr. Marsh right at the head of the list because he's our coronavirus czar, and boy, what a superstar he's been, and all the way, and as the same for all the folks that have really weigh in and really help us in every way here, but in this situation, Charles, you better believe that our general public is in bad need of the booster.
All right, thank you, Charles. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams, Ogden Newspapers, and thank you, Jordan, for kind of working me at the last minute. I want to piggyback on Mark Curtis's question on monoclonal antibodies. I know Kentucky just announced yesterday that the federal government is making a change in how monoclonal antibody treatments are going to be distributed to states. Politico had a similar story yesterday talking about how that is being changed. Some of this is in response to some of the southern states that had the highest numbers during the summer, using these more or less as an alternative to pushing the vaccine as hard. Obviously, we've pushed the vaccine very hard and continue to do so here. I didn't know if the medical team or General Hoyer could talk about what you are hearing in regards to how West Virginia is going to be getting its allotment of monoclonal antibodies and how that's going to affect things going forward. Thank you.
Stephen, I'm glad you came on, but I'm going to probably have to defer again to Dr. Marsh, but I would say this, and I'm sure Dr. Marsh knows this as well, but the Biden administration is cutting people off, because they think that people are trying to short hop and not follow his orders as far as getting everybody vaccinated. I mean, this is getting to be, no question, it's getting to be more and more and more of a political food fight, and maybe General Hoyer can answer this and better than Dr. Marsh, but the net of the whole thing is we can continue to try to do any and everything we can to make sure that we have the antibodies. We're going to have a further announcement on Friday, I think, and but General Hoyer, if you could take over there.
Yes, sir, Governor. So, Stephen, we've had a series of meetings, and the Interagency Task Force and DHHR Health Command been working the appropriate logistics pieces of what we need to do related to the antibody availability. So we will have more for you available on Friday related to that. We work right now to manage across the state. If there is a location or a hospital that doesn't have enough doses, we work across Health Command and the Interagency Task Force to help move doses where they need to be moved to. But we'll have more updated information on how we will respond to rolling out what needs to be done going forward. Thank you.
Thank you, Steve. Governor, I'll turn it back to you to close out.
Okay. Well, a lot of good information has been passed around today. I try, as I do in everything in my life, I don't want to ever have the thought that I know everything. I mean, first and foremost, God above should be in all of our lives and should be directing and helping us. He wants to do that. He really, really wants to do that. And I want him to do that in my life always. But at the same time, I know that he expects us to try to continue to learn and expand our knowledge. And so while the briefings are going on, I'm listening as well as pre-briefing and all the different work that we do on and on. But I just listen. And then I try to echo the thoughts that have already been said. It was said by Dr. Marsh early on, I think it was Dr. Marsh that said that our beginning goals and still are these goals, and that is first and foremost to save lives. I mean, is that not exactly what we've tried to do? Save lives. But the secondary thing that we've tried to do always is to absolutely not let our hospitals get overrun into a situation to where we can't administer care, and we get in a situation to where by being overrun, then terrible decisions are having to be made, where people are just having to say, this person could live, you're going to have to die. And so in this, I appeal again and reach out to all those that aren't vaccinated. if you don't do it for me, or don't do it for your family or baby dog or whatever it may be, you don't do it for yourself, will you just step back and just think just this? There's going to be somebody in a hospital real soon that's going to have to look at this person and say, we can get you an ICU bed, but you can't have one because we don't really think you're going to make it. Would you just, as I appeal to you, would you just think of how tough that is? You know, the family of the one that can't make it, the doctor or the nurse or whomever it may be that's telling them, we don't have any place for you. You know, would you just reconsider for those folks? Now, the other thing I would tell you is just facts, and it just came up again today, but just imagine this. Imagine this probability, the chance you have in life. If you're vaccinated, of the 3,296 people that have died, if you're vaccinated, the chances of you being one of those are 0.011%. The chances of you being one of those 3,296, 0.011%, that you would have been one of them if you had been vaccinated. That's the real number. Of all that 3,296 people, 0.011% have died that were vaccinated. You know, I want to talk to you just 1 second about just this. You know, we go out and we take that beautiful bulldog that smiles and makes people laugh and everything, and she loves everybody. But what we're able to do with that little bulldog, it's not little, but what we're able to do is we're able to get in front right now of a lot of kids. And it is a platform of trying to tell those kids, we got to get you vaccinated. And a lot of those kids will go. We're seeing it all the time. You know, and so I urge you in every way to get vaccinated, especially our kids. Now I want to just say this, then I'll be quiet. I think Dr. Marsh or General Hoyer, I can't say who updated these numbers. 893 hospitalized, 275 people in West Virginia on the ICU units, 160 on ventilators, or 275 in the ICU units. To tell it like it is, and just to be blunt and truthful, because see, I'm always hung up on that. You know, I've challenged people all the time, find something that I've told you is not the truth. You can't do that. You can find stuff where I've made mistakes, but you'll never find anything that I'm telling you that where I am purposefully hiding something from you or telling you something that's not the truth. No way. I'm not going to do it. No matter how bad it hurts or whatever, I'm not going to do it. Now, with that, the reality is no matter what we say here, a lot of what we say is falling on deaf ears. It is. It's falling on ears that are absolutely just defiant and saying, I'm not doing this. I'm just not doing it. And that's your choice. And you know what we're going to be? We're going to be respectful of that till the cows come home. We're absolutely going to stand and be respectful of your freedoms. Without any question, this governor is going to stand by you on that forever. But I would just ask you just this. You can really be helpful. You can really help us. And so I know that an awful lot of this is falling on deaf ears. And believe me, B, it breaks my heart when because I want you to hear me. I really want you to trust me and to hear me. Now, just think about just this. I just had one of our people here running get this, but on August the 9th, we lost 7 people in West Virginia on August the 9th. And on that day, I can remember I hated like crazy. We lost 7 people. But it just so happened that earlier in the day, I'd seen a USA Today paper, and it just said just this right here. We are failing one another. And what it showed was it just showed just this. It says, this is America's 4th COVID-19 surge. Now get this. It says, it didn't have to happen. Let's end it now. General Hoyer, our great general, said today, all of this can be avoided. All of this can be avoided. That was his direct quote. I wrote it right here. All of this can be avoided. Put quotation marks, General Hoyer. On August the 9th, on the front page of USA Today, it's got America in its 4th surge. And it says right here, it didn't have to happen. Let's end it now. There's only one way to end it. There's only one way. Now, we can say anything we want. We can do anything we want. There is only one thing we have. Only one bullet in the gun, and that's get vaccinated. We're either going to keep coming and keep trying and keep reading name after name after name after name, or we're going to stop it. I hope and pray we'll stop it. Thank you so much.